we'll move on to our next presenter now, and that is, please forgive me, Laura, if I pronounce your second name, Laura Diment. And Laura will be presenting on monitoring of prosthetic usage in lower, middle and income countries.
Yeah, I'm Laura. I'm a biomedical engineer at Southampton University, and I've been working with Cicere's team, and we've had 4 students this year who are sitting there with Cicere at the moment. So hello, good to see you. So this work that I'm presenting now is actually the work that they've done as their final year project. So that's Mutta, Ratna, Pli and Snavi. So Pete and I taught a course on research methodology at the Cambodian School of Prosthetics and Orthotics in January. And we showed the students how to use accelerometers and 3D scanners and to set up a clinical study. And then they've spent this year running that clinical study with 10 prosthesis users, looking at the activity levels, community participation, comfort, satisfaction, and change in residual limb volume. So it's part of a larger EPSRC Global Challenges project. We're trying to look at how technology-based data collection can increase the support that's provided for the prosthesis users and reduce the workload on clinicians. So we find that in-clinic tasks that you can do with a prosthesis user can show what they're capable of, but it doesn't necessarily reflect what's going on in their everyday lives. And the interviews and questionnaires provide a user perspective, but they're subjective and time-consuming, and they rely on user recall. So we're looking at how digital technologies can then augment this data collection for things like creating repeatable designs, tracking everyday activity, or tracking changes in the residual limb over time. This particular project focused on the physical and social barriers that correlate with physical activity and community participation. So after amputation, we often find that people report feeling inactive or lonely or more dependent on their friends and family than they'd like to be. So a prosthesis with rehabilitation and community support can help them to regain physical abilities, independence and social involvement. And therefore, we're looking at physical activity and community participation as key markers of effective prosthetic intervention. So we've been working as a cross-discipline and cross-cultural team, and that's been really useful for understanding what technologies are available, what the current practices are, and what information is actually useful for the end users and the prosthetists. So we worked together to design a research question, and then Pete and I were teaching about how to use the technologies, how to undertake research and how to analyse results, and the students ran the trial themselves and did all the translation work for us. So as far as the methods, we've got some more users going through at the moment, but the results I'm showing here are from the first 10 participants. They're all lower limb prosthesis users. There was a questionnaire that was asked on the demographics, community participation, prosthesis satisfaction and comfort. And that was asked back in January when we started the study, and then again in July at the end. Questionnaires, but we did pick and choose the questions that were most important to us, and there were modifications for the context. And then we collected data from the accelerometer for 10 weeks. So from the demographic stuff, the main thing I'll present on here, we use the age, how long they've had the amputation for, and what job they're in currently. For the community participation, it was divided up into 7 categories. Participants before and after the trial mentioned how frequently they were involved in each of these studies. Self-reported activity took that information from the community participation and also some additional activities like housework, climbing stairs and walking more than 1 kilometre. And it was multiplied from the frequency by the energy expenditure of each of those activities. And then society perceptions have been based on the results of the TAPES questions. And then just ranking people from those who felt that they weren't accepted in the community with their prosthesis to those who felt that they were very accepted in their community. Satisfaction was scored from 0 to 10, from not at all satisfied to very satisfied, in a bunch of different areas for things like socket fit, usefulness, appearance. And then comfort was also scored from 0 to 3, from none to severe, on different types of discomfort that they might experience. The accelerometer data, we will be looking at what types of activity they were doing, but at this stage, these results are just based on how many steps per day and how many hours of wear per day. So the 3D scans were analysed using AmpScan, which is now available online if anyone's interested in trying it out. It was developed at Southampton, and it compares two scans, so you can get these mapping images of how two scans related. So here we've got a socket and a limb, and you can see some of the rectification that happens at the patella, and it also gives you a bunch of graphs that can be useful. But what we used for this was the volume change from the first scan in January to the scan in July of the residual limb itself. Because the questionnaire data is ordinal and the percentage volume change was non-parametric, we've used a Spearman correlation to understand the relationship between each of the variables. But we do have to note that there are currently only 10 participants who've gone through this, 2 questionnaire time points, and a lot of variables we're looking at with no analysis of the effect of covariance. So we can't rely on these correlations to really understand what's going on, but they do give a good indication of which type of variables might be worth looking at in greater detail in the future. It also gave the students a chance to learn some general statistical methods and to discuss correlation versus causation and reliability of results. So it basically puts one variable on the x-axis and one on the y-axis, and it gives you a number between 1 and -1 as to whether it's positively correlated, no real correlation, or negatively correlated. So for each of the measures that we looked at, it was a score that was generated that was basically a summation of everything that we knew about that score. So for here, an example is community participation was how people scored on each of the sub-questions at the start and then at the end, and they're all equally weighted to give a total score for the participant for how engaged they were in their community. And then from this, they were ranked according to who was least involved in the community to most involved in the community. So that's this rank here, made up of these rankings for each of the questions. And that can then be compared to other measures that we also did in the same kind of method. So if we look at some of the results, here's a selection of ones with steps per day from the accelerometer along the base.
Just had a little bit of issue with the audio on Laura's presentation there. If you just bear with us, we'll resume shortly.
Thanks, Andrew.
Sorry, I'll try turning off my camera. Does that work any better?
We have you now.
Where do I need to start from?
Point 32 on the slide.
Okay, cool. Yeah, so the community participation versus the step count did not show a very strong correlation. But if we look at hours of wear, it was highly correlated with how active they were, how many steps they did per day. Interestingly, when we looked at the socket comfort, they had the general 0 to 10 score of how satisfied they were with it. They also scored on what types of discomfort they had. And these two didn't actually correlate at all. So if we look at a general overview of all the different correlations from this, we can see each of the measures that we were measuring against each other measure. Blue shows where there were strong correlations, red shows there were strong negative correlations, and yellow means there wasn't really much correlation going on. So here you can see comfort, socket fit, satisfaction, and volume change are all highly correlated with each other, but we're getting negative correlations between social perceptions and community participation and how active they were, which means that people who were more actively engaged in their community and were more active generally were actually less happy with how they were perceived by their community. The other interesting thing to note is that the older someone was, the more active they were and more they wore their prosthesis, which again might show more of the demographics. Our oldest participant was 60, so it's quite a young demographic compared to the UK. And again, it's trauma as the main reason for amputation. So the key findings were that accelerometer data did correlate with self-reported activity, and the people who were more active reported better socket fit, satisfaction, and more variability in the residual limb volume. Community participation didn't really correlate very strongly with any of the other measures, but we do have to remember that we are looking at a lot of variables in a very small sample size, so there's a very high chance of false negatives and false positives there. The additional 9 participants who are coming through at the moment will help us a little bit more to understand how reliable these results are and to work out which variables are most interesting to study in more detail with a follow-up study. But we did find that the accelerometers and 3D scanners were easy to use and provided useful additional information on top of what we could get from a questionnaire. Thanks.
Thanks very much, Laura. We're just going to move over to John now for some questions, if that's okay.
Yeah, certainly. Well, first of all, Laura, very, very interesting study. I mean, obviously, you had to sort of whiz through it a little bit because you've only had about sort of 10 minutes, and I appreciate that. But you did manage to get quite a lot in there, which was really good. You probably noticed that when you put up the slide on socket fit, I've had to wear the glasses now. I'm getting old, so I can't read so well. But I almost head-butted the screen. I was that keen to see what the correlation was between satisfaction and socket fit, and I could see that there was a correlation there, wasn't there? You know, there seemed to be this kind of link between the two, which I guess I think just shows that. Do you know any other? Have you looked at any other studies from perhaps here, for example, where have you compared perhaps UK studies with the studies you found from over there? If you had the chance to do that yet?
We're in the process of doing that. We've got some data currently coming in from UK studies, so I'm doing a lot of analysis between the two, but I haven't looked specifically at very many of the papers. There was one that was from the UK that was a similar kind of study, and that showed similar kinds of things, I think.
Yeah, I mean, I'm interested because I can share with you. I did some work with a UK charity, Limb Power, and it was sponsored by the English Federation of Disability Sports, and we did a presentation about 2 or 3 years ago at BAPO, and again we used tapes R, and we did a correlation. So I'm not, obviously not now, but after the event, if you'd like to, I don't know, compare notes anytime with that study with yours, then yeah, be more than happy to do that, because I think, as I say, your methods were very similar, and it was very interesting to see the correlation. I haven't got the other study in front of me, but I think it just shows, doesn't it? People are the same wherever you go, and often the things that link us in terms of what we want from our prosthesis are quite similar.
Yeah, that sounds great to hear about what you've been doing.
No, absolutely. Well, look, thanks again. Again, a really interesting presentation. I'm sorry we had a little bit of a problem there sort of halfway through, but I know we got the gist of it all the way through. So thanks again, Laura. Really nice. Thank you.